super extension. You can actually snap vertebrae. You can get like pieces of the bone to break off. We worry about those getting inside the tube or the tunnel where the spinal cord goes. Oh, come on. Come on. Would you have that much bleeding? No, it looks like it's like bubbling over, like too much hot water in there. Super dark, so dark blood meaning that it could be venous blood, not arterial, which is super bright. And then obviously there's this magic component where he's flying in the air. Oh, and then sliced in half. Such a good job of the half body anatomy that we see. Now it looks like marbling of like a steak when you get like a Wagyu or Kobe beef steak where there's a lot of fat tissue in there. Probably not as much in a human. You see the spine, you see the hump in the back that's typically mid-thoracic area. Oh. Destroyed right through the chest. You see some wiggly blood vessels.
Wibbly wobbly.
So super cool. Hard to actually see exactly which vessels they are, but you have your big aorta that comes off. You got lots of branches off of the aorta going to each side. Looks just like this. Wow, really good job. And then there's that pad on top of the heart. The fact that it's still beating a little bit, it probably could beat for a few beats outside because it's still having some electrical impulses and action potentials due to different gradients of how cellular activity works. Whoa, we're losing a limb and the blood is pouring out. You'd have arterial bleeding that would be pumping out. And if this actually were to occur and you are on scene or you would see somebody like this, this is where you would actually want to use that tourniquet that everybody wants to use. You want to use not a belt. You want to use something that's more fabric so you can get it tighter and have a fulcrum to spin it with. You want to stop the bleeding ASAP. Anterior stab to the neck, but actually looks like that blade has a curve up. If it was going straight through, you worry about the airway, which is midline. The esophagus is just midline, but actually to the side a little bit. And then straight through to the back would be your spinal cord and the brainstem. If it hits the brainstem, your autonomic nervous system, which has to do with automation, breathing, and impulses to our heart, would actually cease to function, and you would die. Grenade to the mouth explosion. This is actually not that abnormal of an injury. This amount of facial trauma does come to the hospital. The first thing you need to do is secure an airway. It's actually easier than you think because you have direct access to looking at it. Just put a tube in there, then controlling the blood and getting a facial plastic surgeon involved to work on trying to fix this in the future. Whoa, there we go. There's some Mortal Kombat moves. Fracture to the face. These are intense fractures. Besides the ice pick blades to the brain that are not sustainable with life, nasal bone fracture, transmitting energy all the way to the skull. Here is bone. Down below it is cartilage. You can cause a lot of pain and actually can cause fractures of the maxilla above here and actually can go into your arches on your head. Wow, very cool to show us the ribs. Ribs aren't that big because a lot of it is also cartilage. Unless you explode open, you wouldn't fracture all those different pieces. Most of the time when people fracture bones, it's usually in one or two areas, not all of these. Oh, Nelly. Cool. I don't even know how to react to that. Like a meat grinder. I've seen people come to the emergency department with injuries in that industry. They get too close to heavy machinery and a limb, a digit gets stuck and gets just destroyed. I've had people not come in with their limbs. They've left them at work. If you have the appendage, bring it to the hospital. Make sure it's in a cool water ice bath that's not directly in it or on it so it doesn't cause freezer burn. Oh, is that like the kiss of death? Wow, so somebody being burned. First degree, second degree, third degree. We talked about fourth degree. Third degree burn typically does not hurt. It singes the nerve fibers. Sometimes second degree deep will also need skin grafts. Obviously, if you're having fourth degree burns, you need a lot of reconstructive surgery. You also have to worry about when somebody's fully burned like that there's airway compromise because the fire is taking the oxygen away from where you're breathing. And then you're actually potentially also breathing in the fire, which then burning the mucosal membranes, increase swelling to that tissue. Oh, wow. We're seeing some good bone depiction of the neck.
Look at that neck!
This is not a chiropractic technique. Way too much force in one direction. Chiropractor or an osteopathic physician would do a technique to where it's called HVLA, high velocity, low amplitude, where it's super fast but not a big motion. Oi! What's left? Oh man. They love this half-face look. If you see in the nose, you see the empty spaces. Okay, that's normal. It actually would be typically bigger than that.
Bigger?
The nose just doesn't go up into our brains. It goes back and then it connects to the back of our throat actually. And then you're seeing part of the mandible on each side. It's exactly what you would see in a CT scan of their face because we're doing slices. Whoa, what a crazy contraption. Straight through, midline, ripping right through the sternum. They have sternal saws. So when a cardiothoracic surgeon needs to do open heart surgery, they take a saw and they cut through your sternum so they can get to the heart, to the pericardium. And then they put you back together by using medical chicken wire and wire you back shut. Come on, that's like cheating. I want to see not just fully skull gone. Like maybe they need to leave some muscles on the skeleton just to give a little bit more color or intensity to it. Oh, very cool move. Jaw now looks like it's getting dislocated, and then obviously the vertebral bodies in the back are totally destroyed and gone. We don't typically see too many where the bones just shatter like this. Sometimes in like major traumas, are they in pieces, so to speak? Oh, see the wings of the scapula. They look like wings, and it's cool because there's attachments of different muscles to that area. It has to do with all these different types of movements and attaching and how our arms move on our bodies. Super cool. The arms aren't actually really attached by anything. They're just attached by connective tissue, not bones. Boom. Oh! Whoa! Come on! Come on! The intestines wouldn't go all the way up to the base of the skull like that, but you got your small intestine to your stomach, to the esophagus, to your throat, but we're missing the stomach there. It's not in the depiction. What? The head just flying off. So you have your carotid arteries that are coming up each side. You also have vertebral arteries in the back as well as your basilar artery. So those could potentially bleed a lot versus just venous pooling blood that's gonna fly out of there. And actually we saw some remnants of what appears to be the spinal cord with some vertebrae. Whoa. The classic hole straight through the middle of the body. What are you busting through in that area? All your intestines, goodbye. The omentum that sits over top of it. And then you have your renal system, your kidneys in the back on each side. Those could be gone. Typically the kidney is higher on the left than it is on the right, due to the liver being there. And then you have your ureters, which are the tubes from the kidneys down to the bladder.
Oh man, of course, here we go with Kenshi, the fatality. Oh my God. I felt so dumb doing this in studio because all I had to do was like pretend.
Right.
And they're like, that looked great. Trust me, we're gonna use that. I'm like, okay.
Because you have telekinetic skills.
Yeah.
Obviously it's not real. And every time I say it's not real.
Don't say it's not real. Yeah.
Right at it. People actually do
like the circus stuff, right?
people.
Where they put the
can
swords
swallow
down.
it. So the intestines are actually really robust. So people swallow sharp things all the time and they actually don't cut themselves.
That's crazy.
It's crazy.
Do they like have to like extend the muscles a little bit?
They
or?
relax it. Because
Okay,
the esophagus is just all
right.
circular muscles.
Okay.
After a lot of practice.
That was not the point of this.
No, and nobody should ever do this.
Yeah, don't ever try. Okay.
Oh.
Here we go. Blade out. And
Oh, body cut.
That's what I was waiting for you to see.
This is awesome.
If you had to pick a way to cut through somebody, head all the way to the or
the
first.
That's a great question.
Yeah, what's easier to cut through?
Probably easier to cut through the bottom end to the
bottom
top.
end?
Yeah,
Okay.
because of the bones, the way that your pelvis is structured.
Gotcha.
So it's easier to get through that section, but then it's all the same all the way.
Oh, Katana. Katana's sister made me blind. Milena is her name. That Sonia.
Oh!
Would the bones really fracture in that way?
They could.
Okay.
They could. They can snap. It's just because like a chicken wing.
Literally,
Fish bone.
yeah.
Yeah, when you try to snap it.
With your
different pieces.
ribs, though.
Yeah.
Wow.
Same idea. So the ribs, they're a little bit longer than this. They feel a lot longer.
They feel way longer, yeah.
Yeah, but they're not as big as we all think they are. Because think about it, CPR. It folds in, these will snap right here. Every time you do CPR, the chest cracks.
Really?
Yes. Oh, there it is. Exaggerated cervical spine injury where it's snapping, crunching. Maybe the vertebrae are breaking, but you're actually breaking more of the connective tissue. It's snapping all the ligaments that are attaching that area. Gotcha. Maybe breaking the bones because of the attachments. The spinal cord, I've said it before, it looks like polystring trees.
That's disgusting.
Yeah, but it literally is like that. Ooh.
Johnny Cage, let's go.
Oh, snapped your back.
If she fell from that height,
you could potentially have a spinal cord injury, but the explosion of the vertebrae probably not from that height. Probably needs to be higher.
damn.
Yep. I've had back injuries before from like playing soccer and stuff. I don't know if you've had any crazy weird injuries.
I have snapped my L4 and L5.
Oh, yeah. Mine was just a transverse process of L5.
Mine was spinning too damn much.
Oh my
Stress
gosh,
fracture, yeah. What is that? What did he grab? It's the camera.
Oh
Johnny
my
Cage.
Gosh. Our cameras aren't that big here. Have you ever broken somebody's rib before by accident?
I have, yeah.
Yes.
You feel a little crunch. Mm-hmm. Yeah, you can feel it. Feel it! I feel bad.
Oh.
Using that as leverage to jump up.
Super cool.
If she had metal fans, could she go through somebody's skull like that?
If she's strong enough and enough force.
Yeah,
yeah.
you think so?
I've seen people bounce knives off someone's head or go in.
What do you mean bounce off of there?
So like you try
throw a knife at you?
No, or like they try to stab you and then it's not enough force, so it's like ding. Yeah.
That's crazy.
Bounces off. Because people will tell me like, no, that'll stick in. I'm like, not necessarily. Did you do that move?
That aerial was me. Yeah. And I would never try to attack somebody with that. Unless my feet had fire on them and I was a god. That's the only time.
Because there's no power.
It's not even realistic because the first moment the first foot hits you, my momentum has to stop.
Yep, so you just drop.
Yeah, I would just drop.
Yeah. Oh! So that's a classic move for him. You can have hyperextension injuries. I have people fall out of trees and land on like the curb and they snap their spine. It happens. You actually look for step offs. So if you ever injure somebody or fall and you want to feel the back and just looking to see if there's like a big step off, then you know there's a significant spinal cord injury.
Oh man. Yeah.
Oh, nice.
It's a forward roll, kip up.
Yep.
And it launches me in the air. And then we did the traditional bicycle kick to the ribs there. Yeah.
Which will cause bruising. You can maybe break a rib. The thing I always worry about, even if you don't break ribs, is bruising of the lungs. So if you bruise the lungs
actually getting bruised.
They can bruise.
Oh, wow.
And if you bruise them, blood's in the way, you can't oxygenate. And you can bruise the heart, obviously, too, because the heart's a muscle and has blood. Oh, super cool move.
Yep.
The body just...
Yeah, it's just, disintegrated, done.
I mean, burns can melt you, but not that fast. Unless it's super hot, like...
He's a god of fire, though.
I mean, it's like a furnace. When like, unfortunately, when somebody gets cremated, their body disintegrates.
Yeah. That's crazy. I've never seen anybody do that where the blood is shooting out of the arm.
Correct.
But you could
do that. Yeah. And they did a good job because it's in a hyperextended position.
Right, so the hand's going down.
And they can potentially, you have enough strength to be able to do that. And you have a fulcrum.
Yeah.
Because it's on your back and the weight's going the other direction.
You'd have to be really strong.
Really strong.
Yeah.
Oh, so cool. What?
I always wondered like how the hat didn't go through the rest of the body. I'm in the line of fire. Yeah.
So the face is being sliced in half. Depends how deep it goes.
Right.
You can cut through the face pretty deep and still be alive.
That's crazy.
Right, because it's the brain that you're worried about, so it's up top.
Right.
Body in half, totally. I was not expecting that. Yeah. This doesn't even look like a human anymore.
This is all my stuff here is Raiden.
Ooh.
What was really cool was I had the original action director in the room, Carlos Pensina. He was the original Raiden in MK1.
So cool.
And I got to play Raiden in MK1 now.
Oh my gosh.
Yeah, so I had the OG directing me as Raiden. It was awesome.
Blunt trauma. Ooh.
How strong would your thumb have to be to crack the windpipe?
It's cartilage. So the
Okay.
windpipe is all cartilage.
It's all cartilage.
Doesn't go completely around except for one piece, which is the cricoid, which sits underneath the Adam's apple. But to be able to crack it, you need to be really strong because cartilage bends.
Gotcha.
It's not like a bone.
It's flexible,
It's
yeah.
very flexible.
Which makes it harder to break.
Right. He's probably stroking out because of the...
Stroking out, is that a term?
Is that a technical term?
Yeah, so you're stroking, so you're having
Stroking.
a stroke, yeah.
Okay.
Because now he's getting blood, probably clots going to his brain from the damaged blood vessels in
Oh
the
my
neck.
god.
So cool. Yeah, that would actually destroy the
That
ribs
would,
and the body.
especially from that height.
That height. So we always talk about major traumas. So major traumas are 3 times a human's height. 3 meters for everybody internationally, but like 15 feet. It doesn't mean that you're going to get destroyed. It just means that there's a potential. Even for him, as he's coming down, I worry about fractures to the feet and into the spine because you're landing so hard.
Ankle's gone, knees gone,
Right.
you're feeling everything, yeah. Okay, the internet, just so you know, is calling her Mommy Sindel.
Ooh. I feel like I've seen it.
said, ooh.
Too bad you will die.
We have hair tourniquets.
Hair tourniquets.
Yeah, typically it happens in the pediatric population where the hair gets wrapped around the finger or
Oh,
that actually causes decreased blood flow. We have to figure out how to get it off. Nair.
that doesn't sound good. Nair.
Nair.
Yeah.
Just so it burns through the
Yeah.
the hair.
So you're just gonna bring like a giant bottle of Nair to fight Sindel?
Yeah. Oh.
That would end you. if it
Correct.
kicked-
End you.
If a horse kicked you like
Correct.
that, yeah.
We get people who fall off horses. Typically, we don't see that much of blunt trauma, but if we do, it's a major trauma. Scan everything. There could be bad outcomes. Usually, it's like one kick, not a
Yeah.
double jump, flying
That's
back
true.
knuckle thing. Have any of you guys out there ever fallen off a horse or been kicked by a horse? Any horse injuries? Let me know in the comments.
Okay, here's Mommy.
So somehow he's still alive, but he's not. Oh! Oh! What? They did a good job of blurring the area, so I can't really tell anatomy.
They ripped his pretty much.
Right off. I look at it as he tore it right through his rectum.
Yeah.
Straight up the rectum.
Straight up.
Now I have time to look.
Yeah.
This is your femoral head. On this
Gotcha.
side, you have another one. This side, actually really nicely designed, but the pelvis would be shattered. Oh, that is a realistic injury. I can
Yeah.
feel it. Hyperextension injury. They actually typically will dislocate, maybe fracture
Yeah.
sometimes, but the amount of force.
And it's really easy to generate a ton of damage with this type of kick to that area too.
The leg you're hitting is locked to the ground.
Yeah. The martial arts Krav Maga does a ton of this type of movement because it's so dangerous. It's not really used in sport.
Right.
So like Muay Thai would be the closest where they do low round kicks to the leg.
Yep.
This one's cool.
Ooh, that's cool.
That's
No.
the one thing you don't want to get injured.
Protect your head.
Yeah,
Yeah.
always.
Have you ever had a concussion?
Absolutely. Competing for a tournament to place in the Junior Olympics. I got kicked in the head.
Yep. Do you wear,
I was
do
fine.
you
We
wear
had
the
helmets.
Yep.
Won the round. Went to the bathroom, violently throwing up. Put my helmet back on. Went and took first.
Wow.
But I was really dizzy
Yep.
and I was so nauseous.
Yep.
Here's Scorpion.
Oh!
With the famous get over here through the intestines.
Through the intestines. We don't have pools of blood that just do that, but that's okay. They did a good job. Tube structures all together in one piece.
Tubes.
It's not that effective. is it?
No,
Yeah,
no,
okay.
it's definitely not.
It's super cool looking.
That's why it's in Mortal Kombat.
Yeah, it's super cool looking. You've been doing this for a long time, so you know how to actually land appropriately, take the falls. I see people land on like an outstretched arm and snap their wrists off.
You
So-
cannot do that. So you learn how to roll
Yep.
safely and then fall and slap fall. I have literally watched people put out their arm, snap.
Ooh, who is that lady with a nice blade?
That's Natara. I've trained with a lot of different weapons. One of the ones I have never trained is a bullwhip. If you guys have watched Ahsoka on Disney Plus, the lady that plays the Night Sister, her name is Diana Lee Inosanto. Her husband does the best bullwhip I've ever seen, and it is vicious to watch. Yeah,
Okay.
very powerful weapon.
Oh, puncture wound.
Yeah.
Puncture wound.
Lift them up all the way through.
And it comes out the front. There is always a lot of blood on the opposite side of your skin because our skin is so vascular.
Yeah.
That's why we bleed so much. So they did a good job of pulling that off.
For film, I've actually had to like carry somebody by the throat.
Yep.
And it is so hard to
super
pick
heavy.
somebody. Yeah.
So when you're lifting somebody up like
Yeah.
that, do they ever like help you and put the other person like on like wires to
wires.
lift them up?
It depends on the budget.
Okay. Okay. Oh, it's like bad road rash. When you train and you're sliding around all those mats,
Yeah.
burn skin off ever?
Oh yeah, for sure. I mean, elbows,
The rug burn, yeah.
knees, ankles, a little
Yeah.
bit, feet. Yeah.
But now you've done
But
it.
not like that.
Not like this.
Not even close.
All I think of is infection. That's what I think about. That's what I think of. That's where my brain goes.
You sound like my mom.
Oh,
Yeah.
across the body. Holy
Yeah.
cow. I love that the ribs are sticking out. They're going down a little far.
Gotcha.
Potentially too far. Maybe hits a little bit because your hip bone is just a little bit above there. Should be
Sure.
a gap. But,
You can feel his pain.
right, like the
there.
teeth are even good.
Yeah.
Fancy car.
No, it's me. It's me.
What? Oh.
And then take off with the car. With the intestines, I told you they were gonna do it.
The intestines wouldn't be stringy, but they are stretchy.
Yeah.
And there's a muscle and it will pull like that.
I think it's more beneficial that I am blindfolded in this scenario.
Correct.
Too. Yeah.
But the problem is, this character is blindfolded, but their other senses are much higher.
Yeah.
Which means your sense of touch is a lot higher. Which means it probably hurts a hell of a lot.
Yeah.
That's gotta hurt.
Here she is.
Oh, katana.
She stole my eyes from me.
Oh my goodness.
Yeah. But at least she looks good.
Oh no.
That's Reptile.
Oh.
That's another character I
That
got
is
to do.
super cool.
Yeah. Anytime you're playing the game and you're attacking or winning, that is me. Anytime
okay.
that you're defensive and still winning, that's me. If you're losing, I did none of the motion capture.
Oh.
Yeah.
I'm always on the winning team. Yes. Yes. Oh.
Yeah. Oh, here's the mouth. Here we go.
Wow.
Yeah.
They did a pretty good job. It's very dark brain. Brain is more like a white gray, a little bit more color to it.
Okay. So it's not like the traditional pink everybody thinks it is.
No, the pink is related to the blood. His blood is like green.
Because he's a reptile.
Yeah, so that's probably why it's darker.
Ah, that makes sense.
Oh, all I think about
So
is
she just said
rabies.
that. Rabies.
Rabies. Sometimes a bat bite you can't feel, so you don't know.
I remember the Office episode
Oh,
with
okay,
Meredith
perfect.
gets
Yeah.
bit by a bat.
Yeah.
Yeah.
So you gotta get the rabies vaccination. Not too bad. There's like different series, depends. But if
Okay.
you have a known bite and you're very concerned about rabies, you actually have to get the immunoglobulin. So like the antibodies right then and there.
Okay.
But you have to inject a high amount of volume into the tissue, which hurts.
There's what I've been waiting for that for you. There you go. There's your 30 feet of intestines
30
flying
feet.
out.
Oh.
She's yanking it in the
Yeah,
sky.
there you go. It's like a bungee cord. It's so creative. I can't believe that just happened.
My best friend's grandpa, who competed with Chuck Norris in the 70s and 80s, used to fight, and for the grand championship, he got kicked in the groin and his testicle flew out.
Out?
Finished the round, beat the guy, went to the hospital.
I'm assuming the scrotum ripped open and the testicle went flying out because it's probably still attached by the spermatocord and all the other connective tissue. Did you know that when Chuck Norris does push-ups, he actually pushes the world away?
You're so bad.
What? That is sick. That's so cool. Scorpion bites, they hurt like heck. I'd probably have to ask my dear friend, Coyote Peterson, about scorpion bites. Most of the time, scorpion stings are not fatal. There's like 1,500 species or some crazy number like that, and maybe only 30 of them have a sting that can get you, so to speak. So most of the time, you're probably okay. What? Just like a lot of the other venom that we see in other insects, creatures, that sort of stuff. Most of it is like a neurotoxin and like a myotoxin, meaning the proteins, the peptides, everything that's injecting into that area will affect the nerves and the muscles and the cells, thus giving you pain and different types of effects of like spasm or paralysis, those sorts of stuff. What's this? Oh my gosh.
Animality.
Skin, muscle, connective tissue, gone. All that's left is bone structure. Whoa. Cool. What would be equivalent? Maybe totally dipping somebody's body in acid. Has anybody seen out there museums where they do the anatomy, like body worlds or body exhibit? There's skeleton sections where it's just a skeleton. Hey, it's my buddy Noah. No, I'm just kidding, but I played this character. Oh my gosh. Reminds me of the plant from Little Shop of Horrors. Anybody seen that? Let me know in the comments. But look at this tongue. Holy cow. What? What? Injuries that we see relating to compressive forces, a lot of times it's like car accidents, or you can think about somebody just like being crushed because they fell from a great height landing on the ground. It's kind of the same impact type forces as crush injuries. Besides fractures, we worry about like the breakdown of cells, and elevated potassium levels can lead to cardiac arrhythmias and cardiac arrest. Oh, look at this. Is that a T-Rex? I think it's a T-Rex. Ow. They did such a good job.
You did a great job out there.
Amputation of the right arm, lots of the red stuff flying. If you survive this, right, we worry about like infections. You know that the human mouth is much more dirty than animals. Obviously, we treat animal bites in the emergency department. Typically, dogs and cats are the most common. Sometimes we'll have smaller creatures. We do worry about the animals that can potentially give rabies, such as skunks, foxes, raccoons, kind of like medium-sized wild animals. Oh, this is a woolly mammoth, right? Holy cow. That tossed and spiked, right? Oh my gosh. Look how sharp that potentially is, and impaled straight through the spine in the back. You're paralyzed from that level down, right through your major blood vessels that are running down. The aorta runs down on the back of the spine on the inside on the left, versus the veins coming up from the lower extremities are running back on the inside on the right of our bodies until it hits into the liver as it's cruising up through that area. Oh, a ram of some sort. Oof. Oh, very cool. Blunt trauma so hard, causing either vomiting of blood or coughing up blood. Hemoptysis versus hematemesis. Two fancy medical words. Heme, blood, it's the precursor. You know, a lot of times we see in shows all this blood coming out of the mouth. Sometimes it's real, sometimes it wouldn't anatomically make sense. Here, it potentially would. Porcupine quill injuries? Yes, definitely would show up to an emergency department in an area where you would see porcupines, not where I live. We don't see these very often, but again, treated all very similar. They are puncture wounds. Are they like dangerous, so to speak, from toxins? No, but they hurt. These are massive. These are like the javelin that you'd see thrown at the Olympics. So a penetrating trauma to somebody's head like that will need to get checked immediately without pulling that out. So you're going to pull that out in the operating room if you're still alive. It depends on the structures that it went through. It might be low enough to have missed a lot of the major structures of the hemispheres of your brain. It could go through your midbrain where all your major structures are. That's kind of at the beginning of where your brainstem is. Your autonomic nervous system, which affects your heartbeat as well as your respiratory drive. Oh, a cobra snake. Oh, didn't even bite him. You're getting crushed on the outside. Equivalent would be massive car accidents where you get crushed, or in a dumpster truck by accident. Slow pressure on the area. You won't be able to expand your chest to be able to breathe. Ribs crack pretty darn easily under this type of force. They can puncture into your own lungs, causing bleeding or puncturing holes into the lung, making breathing even that much more difficult. The skin color changed to a bluish purple, which is what we see when people can't breathe. Oh, octopus? So your body is pulled apart. You haven't succumbed to the injury yet. You're not going to die immediately. A lot of times we see in shows, movies, games, people die pretty quickly, when in real life, it takes a little bit longer. Drowning injury, so screaming underwater, hard to do. And then you take a breath and you're going to either inhale the water into your lungs or swallow. At some point, you're going to be doing both, and then you're going to have a drowning event. Oh my gosh, pandas. Panda. Ow. That area, you're going to be ripping right through your brachial artery. That's why there would be a lot of bleeding on that side. If you hit the artery, it's going to squirt out in a pulsatile manner because of your heartbeat, versus the vein is going to bleed out more in a stream. Typically not this thin and easily bleeding, so to speak, unless there is some sort of blood abnormality, elevated lactic acid, decreased pH of your blood, or you're on a blood thinner. Oh, arm didn't come off where it was bitten. It came off more proximal, and it's almost like the toys that we used to use as kids where the shoulder attaches versus like mid humerus here where it should have broken off from, so you'd actually have a place to put a tourniquet. Now you just have no arm there. It's just a socket. So now you have to try to find the vessels, stop the bleeding. What you're going to do is just shove a bunch of material, gauze into the cavity and put pressure on it as best you can. It's pretty gnarly and massive. Oh, that was actually a funny.
I made a funny.
Mortal Kombat loves to cut bodies in half. You have something called the pubic symphysis. It's actually a cartilage in the front disc that separates during childbirth for females, and their pelvis actually opens up. That's basically where this tear starts and then splits all the way through. That doesn't happen. But then you also have this bad bite to the lower extremities. So they're crush injuries plus open wounds. Typically needs to be washed out in the operating room, especially if there's a broken bone. Whoa, we got a bee. A bee? Is that a yellow jacket? What is that? Who's allergic to bee stings? Let me know in the comments. It's a very common allergy to have. Just be aware, make sure you have your EpiPens, know your environment, and get out of there if you have an allergy to bees. Bees are really important for the environment, having to do with pollination and keeping different species going. Ouch. These Mortal Kombat animalities might be all about elevating your moves and beastly transformations. If you're looking to transform your own skills and focus, check out Level Up by my company, Life Happens. Grab your own Level Up at lifehappens.com and on Amazon. Oh, a hummingbird. Very cool.
Very cool stuff.
Oh, not cool. Not cool. We'll use needles about that long to do needle decompression for somebody who has a tension pneumothorax, where the air in the chest is pressing down on the lung, causing cardiac abnormalities. To be able to help fix somebody who has a pneumothorax or air around the lung, we have to do a tube thoracostomy. We make an incision, we'll dissect down to the chest wall, and then we'll puncture through. Once we have a hole, we'll actually put a tube through that hole. Oh, a rhinoceros. Oh, that whole angle of like going like through the groin.
My groin!
I mean, this is a potentially survivable injury. Your lungs and your heart are still okay. You just have to make sure you don't bleed out. But the rhinoceros is going to take that horn out, and now you have a big gaping hole. What are you going to do emergently? Like, that aorta might have been ruptured, so you need to clamp it off for now to see if you can actually repair it and find the ends and put it back together. Ooh, I do not like spiders. Oh, we're actually seeing maybe some intestines come flying out, and they're coming out in pieces. Maybe it looks like a little bit of blood with it as well, but at least it's not like one just stringy piece. All the intestines are attached by mesentery, so they're all connected by almost a webbing. So it needs to be shown in the future games. Oh. Oh, I wasn't ready for that. Impaled through maybe your occipital lobe in the back, going straight through the front, through the frontal bone. That's a lot of tissue to go through. Definitely not really survivable. It's just so wide. So typically we'll have impaled objects that are a lot thinner, so it might go through less brain tissue, causing less trauma and less displacement. We see a lot of people who have burn injuries. Most of the time, burn injuries actually go home from the emergency department versus having to be admitted to a burn center. It just depends on, very simply, how much of the body is burned or a specific area of the body. Ears, nose, toes, genitals, anything circumferential. Even though there might be small wounds, they definitely want to get checked out at a burn center. Whoa, wolf. Double wolf. One's a magical one. Oh. Yeah, ouch. Wolf, you know, similar to dog bites. They grab, they bite, and they also rip, causing the destruction that way, which is what they're depicting here. They're gonna be dirty wounds, so need to be cleaned out. The puncture wounds are really hard to clean. So if they were just lacerations, much easier to clean, but because they're puncture wounds, if they're embedded deep and they're really hard to clean out, that is why they are covered with antibiotics. Oh. Oh my gosh. Mortal Kombat, great job. Because anatomy wise, you see these like weird big shaped tubes that are on the bottom and on the side. That is your large intestine, your colon. Where the heat is being targeted is your small intestine in the middle, probably covered by some omentum, and it's just melting it and burning it. You have the ribs there, you can see the liver on the upper right, you can see the pelvic structures, the hips. Anatomy is fantastic. Could the heat cause it to explode? This amount of heat in this situation, sure. Does it happen in real life? No, but we do see people puncture their intestines. Literally, their intestines can have like an ulcer in it. There can be a blockage. They can have diverticulitis that then pops open and you get free air into the diaphragm and it ruptures. Oh, is that like a finishing move?
Way to die.
We literally separate the head from the body. It's all connected by like tendons and ligaments. They do a good job of depicting the vertebrae. Yeah, they do a pretty good job of it actually, because you're seeing the spinous processes and the transverse processes in the back compared to the vertebral bodies that are in the front. If I was going to tell Mortal Kombat to add anything, would be to give me two different colors of the blood, bright red and give me a more maroon, so you can distinguish between the venous blood and the arterial blood. Oh, I've seen that move before. A massive amount of barrel trauma to the eardrums themselves. I don't know if you've ever had an ear infection, but it hurts a lot. So where's the bleeding coming from? Typically it's relating to the vessels around the eardrum and it bleeds. People will experience this on a much different level. I'm on a new level. If they have an ear infection and the eardrum rips open, or if somebody's in such a high pressured area where say an explosion goes off, you can rupture your eardrums because of the differences in pressures, and then you have bleeding as well. Oh my gosh, Kalima. So much force able to get into the thoracic cavity. Now, you gotta go through the sternum. You're probably going just to the left side of the sternum because you have more space. You got the ribs instead of like a solid piece of bone there. Obviously superpowers, but why wouldn't you make it a little bit easier on yourself? And then you're going into the thoracic cavity, into the mediastinum, the area where the heart and your esophagus and the trachea all kind of lie in the middle structures versus the other components of the thoracic cavity, which are where your lungs hang out. If you're playing this, you'll want to stay sharp and focused, right? That's where my energy and focus supplement Level Up could come in play. It can boost your mental clarity and stamina. Visit lifehappens.com, and we're also on Amazon. Oh.
Not sorry.
Cutting somebody's face and body in half, you might catch the posterior aspects of the brain like your cerebellum or the occipital lobe, and then maybe some temporal horns that you'll be able to see. And then obviously the midface structures, your maxillary sinus, the nose, and then the body just slicing in half, and we're having a ton of bleeding from the middle of the body. Isn't it really cool that we were made that all our important structures are like buried deep within our body? I think that's really impressive. Oh man. What an intense scene. Obviously not as realistic as everyday activities that we deal with or see, but people getting hit by cars, hit by trains, mechanical falls, blunt trauma, you're worried about internal, bleeding, fractures, dislocations. So basically we're guided by not just the mechanism, but by how somebody is feeling, what areas hurt. Oh. So much heat, could it cause an explosion? When we see people whose heads explode open, it's usually due to blunt trauma that's causing, or penetrating trauma due to like a blast injury, like a gunshot wound. And then people's bodies cut in half. We see partially these type of injuries, but not fully all the way through like this. Oh Oh man, massive jaw fracture, probably lost some teeth. If anybody ever has an avulsed tooth, so a tooth that actually comes right out, try to find the tooth, put it in your mouth, put it in Hank's Balance salt solution. Yeah, that's hard to find. Where are you gonna get that? Milk, maybe even water. Don't scrub it because there's specific ligaments on the tooth itself. Oh. People really don't understand the consequences of what they end up doing when they cause this much trauma to somebody's head or face. Could actually kill somebody or really permanently disfigure them or cause permanent disability. So just be mindful of that, especially if you're, find yourself in a situation where you need to defend yourself. Obviously, we worry about infections to the hand, punching somebody in the face, increase the risk of infection because the human mouth is very dirty. Oh my gosh. I've seen individuals get close to that who have connective tissue disorders, but not that far. Obviously, if you're spinning all the way around, causing spinal cord problems, fracturing the vertebrae, or disrupting all the connective tissue of the vertebrae. That's the only way that you can get all the way around like that. So would there be blood that comes out like that? It could if you disrupt the esophagus and bleeding into the mouth. But again, that's where that needs to come out. Maybe the airway, if the trachea gets bloodied up due to the rupture of those structures. Whoa.
Your parents must be disappointed.
I love Omni-Man's cockiness.
Do you really think you can stop me?
That almost looks like a body that you would see at one of those like anatomy exhibits. So you're seeing connective tissue, you're seeing muscles, striations, all the structure, the bones, very cool. The tissue is just gone. Your skin is your largest organ. Has to do with temperature regulation, has to do with getting nutrients to different parts of your body on certain levels, has to do with carrying your nerves and your senses. They did a good job of, as the eye is getting more and more pressure, it's getting a little bit more injected or red to the sclera, that white part of the eye, and then the eye popping out, right? I've told you before, there are 6 muscle attachments onto that eye itself, and then you have the optic nerve in the back. You'd still have some connectivity to the eye. It wouldn't just go flying out. It'd be cool if they had the eye muscles actually on there or the optic nerve hanging out the back. Train. Everything is gone from the pelvis down, bleeding out from down below. Is this survivable? Potentially. If it was a slower process and you're able to control the bleeding, yes, you could potentially survive. You're going to have issues relating to kidney function. If you still have your kidneys, then you probably need some nephrostomy tubes so you can get the kidneys to get rid of the urine. Very rarely is something stuck in the skull. Obviously, if you're hitting in the temple area, it's a little bit thinner bone, but on the top and the back, it's pretty thick.
Pretty thick.
And then you're actually seeing the anatomy, which is actually really good. You can see how deep set the eye socket is. The nose actually has a bone at the top, and you see the teeth, the mandible. This is fantastic, really cool. Yep, and then we get the ribs. Oh, exposure of the spine in the back. You actually see these 2 wings. These are the scapula. The scapula is attached to your arm. You have your humerus that comes up and the clavicle comes on top. When somebody actually fractures the scapula, we have a high suspicion of a lot of other injuries that occur because the amount of force that it takes to actually break that bone. Oh! Holy cow. So the ribs just explode. They don't happen like that. We see rib fractures all the time. When you actually have a rib fracture, it kills. It hurts so bad. The same pain is seen when you actually don't have a rib fracture. Say you have a dislocated rib or a bruised rib or a pulled muscle in between. You can't just like splint it and prevent it from moving. You have to breathe, so it has to expand. So no matter what, you're causing pain every time you take a deep breath. Oh, what? Typically, if somebody's going to be smacked to the ground like that, the ribs are probably going to break in potentially one of 2 places, either on the side anterior or in the back. They're kind of like a C shape, almost like a wishbone. They can snap pretty easy at any point. Oh man, I don't understand how she's getting back up. Ribs fractured on the backside and the vertebral column just popped. Okay. The anatomy is really good. You're seeing the spinous processes, you're seeing the transverse processes, you're seeing a lot of different structures of the vertebrae itself, which is pretty impressive. Oh, I fractured my own back. I know what that feels like. I had a transverse process fracture. Didn't even know it was fractured. Felt like a pulled muscle. I had to wear a corset that had 2 metal rods in the back to keep my body structured. You're really worried about injury to the spinal cord and anything below that area. You may have paralyzation, you might get tingling, you might get pain. It all depends on where on the spinal cord it's irritating you. Oh man, skull on skull, fracture to the posterior aspect, we call that the occiput. Sometimes you can have a skull fracture, a little bit of bleeding around the brain, and you know, it's treatable. Actually, because the skull is fractured and open, it allows the brain to swell a little bit, and so there's not a lot of pressure pushing on, but you also increase the risk of infection. Obviously, you need to be admitted to the hospital, and it's gonna be a long stay. Oh, somebody comes in with a nice cervical fracture like that. We're gonna put a C-collar, a rigid, hard C-collar on. Everybody hates them. If it's really bad, you get something called a halo, where it's actually a device that's screwed into your skull, typically at 4 points, so literally it's attached to protect your spine. Oh! Blade right through the face. We see a lot of people who get injuries to the maxillary sinus, and yes, it could go all the way through. On the opposite side, you're having pieces of the brain back there. We do see people who get puncture wounds where the blade's already out or whatever it is there that caused the injury. You have to be careful of like sneezing, blowing your nose, because you can actually blow air into the tissue and it hurts like hell. Wow. Intra-abdominal, all the way through the spine. Outside of the bones, we think about the aorta, we think about the inferior vena cava. These are your 2 main blood vessels. If you lacerate one of those, you potentially just get a bleed out into the abdomen and you could potentially die. Whoa. You see how the nose potentially goes right in the face, the whole structure here? That's actually called a Lefort fracture. There's a couple different levels of Lefort fractures depending on where they're fractured and how much connectivity there is or lack of. You're gonna need to fix that with probably some plates to be able to get the structure back intact. Oh, wow. I've seen a lot of jaw fractures. The jaw is called the mandible. Usually what happens is if it fractures in one area, it fractures in another area. Treatment for that is having your jaw wired shut, almost like having braces on, but you get a really cool set of pliers in case you feel like you're nauseous, you want to vomit, so you can actually pop the wires off. Not fun. Not a cool injury.
It's not cool.
Typically wired shut for 6 to 8 weeks. Oh. Oh, a high cervical fracture. Those are like super dangerous, super bad. We're seeing the head just snap to the side. You have your C1, C2, C3. Once you start getting fractures at that area, the mortality is pretty high. We actually think about it as almost like a rhyme. C4 and 5 keeps your diaphragm alive. So if you actually knock that out, then you're actually not going to be able to breathe. So you actually have to be on basically a ventilator. Ripped through the solar plexus. That area is the epigastric area. I don't know what organ he's pulling out. Could it be the heart that he grabbed and ripped out? Maybe. Could be the spleen, could be the stomach, could be the liver, could be the pancreas. These are all kind of organs in that area. What? The bones of the eye socket are actually pretty fragile, especially in the back, and your brain's on the opposite side. So if there's enough force and something sharp enough through the eye, you can go straight back into the brain. Typically, there will be some blood, just depends on the major vessels that are hit or not. I don't know if any of you have ever seen the bodies exhibit. They show an exhibition where it's all blood vessels, and you see a high concentration over like your major organs, your brain, the heart. Super cool. You know, even just Google it online. It's very impressive. You can actually fracture somebody's face by kicking them pretty hard in the heel. The heel is a very dense bone. It's actually cultured calcaneus. We see a lot of back fractures that are occurring from falls from great heights. You know, anytime we see anybody fall from 3 times their own height, it is a major trauma. Oh! Super cool to see the x-ray of somebody getting hit in the ribs. The ribs there are basically to protect your spleen, to protect your liver, obviously the vital organs of your chest, your lungs, and your heart. Very cool to be able to see that. crazy end. Oh, Devora just gets smashed right in the ribcage. It almost like inverts. Some people actually have chest cavities on the inside. It's called pectus excavatum. And then people could also have something called pigeon chest, where the chest actually goes the opposite direction and goes out. When somebody gets hit in the chest like that, super worried about blunt trauma to the heart itself. The heart's a muscle and actually could bleed, cause bruising. A lot of times we really worry about the lungs bruising, because if the lung bruises, that area that actually is bruised can't oxygenate tissue. Oh, you get people who get jaw dislocations from opening their jaw too quickly or too wide at the jaw joint here. It's like a hook. And so it hooks in. So sometimes when you open too much, it drops down and then goes posterior and it gets stuck. We need to put it back in. But it's pretty difficult because you're having all these muscles spasming and preventing it from actually relaxing and allowing it to get back in the joint. Come on. Come on. What I like about this is the fact that we have lungs underneath. So if you do have a rib fracture, you always worry about hemothorax, you worry about pneumothorax, you worry about a combination of a hemo-pneumothorax. Pneumothorax is when you have a collapsed lung and there's air that's forming inside the chest cavity that's compressing down on the lung itself. The hemothorax, which basically is blood getting in that space. Oh, crushing the ribs. Obviously, we worry about the heart that's sitting right there. This is the mediastinum, which houses basically the aorta that's coming out, the heart, your esophagus, and the tree branches of your airway. Anybody can look down at their chest, and maybe just below the nipple, you're actually seeing a PMI, basically the point of maximal impulse. You can actually see it kind of bobbing and moving. Oh, whoa. So you're actually snapping all the ligaments.
Do you think I've damaged the ligaments?
I don't care.
You have these very long ligaments all protected. Your spinous process ligaments, you have interspinous ligaments, a lot of different ligaments that are holding everything together. Very vital structure, and that's why we have all this protection. And so when you have injuries, slip disc, it's because there's nowhere for anything to go and it just slips into the path of least resistance. What? We got a gun? We got a bullet that goes left lower quadrant, probably shatters part of the pelvis. The pelvis can bleed a lot and it's like a storage area. So sometimes we can do a binder to the pelvis, typically if it's an open pelvis, and kind of close it down to try to lock down any bleeding. A lot of times there's always controversy about bullets bouncing here and there and everywhere, just like the gummy bears. If it's not fast enough and powerful enough to just blast through everything and just go straight through, it could actually change direction. Oh, I remember the facial injury like that when Apollo Creed died in Rocky IV. Could the bone have gone into his brain and killed him? I've never seen it in real life. Hypothetically, sure, if you have enough force and you cause enough brain trauma with that force, could the bones go backwards into the brain? Yeah, potentially. Oh, whoa! Holy karate chop to the neck. I'm just thinking about my hand, how that would basically snap the metacarpal in half. Having a hyperextension injury like that, a lot of times what you're seeing on an x-ray, the vertebral body will actually bend back and actually can cause a chip fracture. And then the concern with that is that chip fracture going in the column where the spinal cord is, and now you have a free bone floating around. I see a lot of rib fractures from people falling, and then we're doing CPR on somebody in the emergency department. We're causing a lot of rib fractures as well, because the only way to compress the heart is to get deep enough, and the only way to get deep enough is to fracture ribs. Now, typically if you're younger, like say an adolescent or a child, the ribs are actually more cartilaginous. Basically they're softer, so you can actually bend them without having to actually break the ribs. What the? Whoa. What? Oh! Obviously the bones just don't give away super easy, but they can puncture through the skin. They can pop through. We call them open fractures. And if that's the case, if somebody has an open fracture, laceration, blood coming through where the fracture is, even if the bone's not sticking out, there's a concern that there could be an infection of the bone, which then can later lead to osteomyelitis. Oh, burned up. Whoa, 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 whoa. Popping right through the neck. So you have major blood vessels on each side. You have your carotid arteries and your jugular veins. And then you have your nerves running up that way as well. Middle, you have your trachea. You have your esophagus that's decompressed in there, but it is there. The trachea is made up of rings that go all the way around, but they don't completely go all the way around except for one, which is your cricoid. What? Enucleating the eye by the amount of pressure and force. Gotta be super painful. If there's leaking eye fluid, we'll actually put some fluorescein, which is basically a dye to the eye, and see if it's leaking out. If we see a stream, it's called the Seidel sign. The goop is coming out, the fluid of your eye. And if that occurs, you're like, don't touch the eye, cover it, call the ophthalmologist. They need to get in there and fix this right away. We got a lot of rib fractures. All of a sudden we get these Wolverine type claws causing facial trauma, a lot of blood flying out of there. Obviously blood's not supposed to squirt like that on the face. You can get like one maybe splash. A lot of times paramedics will put bandages on right away. We take them off.
Gotta rip that band-aid off now.
And then all of a sudden just like shoots across the room. But it's a stream. It's not just like this smorgasbord of everything. Oh. Wow, I see the frontalis muscle, I see the temporalis muscle.
I see London, I see France.
When somebody actually gets lacerated in these areas, we actually have to make sure they're attached, because if you have your frontalis muscle shredded up and you don't attach it well, you won't be able to basically like lift your eyebrows well. And in certain situations, you want to be able to move your face. Whoa, holy cow, that is like equivalent to the mountain. Sometimes when you pull on the head, you'll actually cause pain relief if somebody's having radiculopathy, basically like compression of the nerves in the neck going out to your extremities. But obviously if you pull too hard and rotate, you're gonna cause fractures and dislocations. We don't actually see that where the body separates like that, but we see compressive forces down. If somebody jumps from a high building and they land on their feet, you get a compressive force all the way through the body and it can explode and fracture. Oh, whoa, definitely flailed segment. Flailed segment of the ribs where they fracture in multiple places on one or two ribs and the whole section is separate basically. And a lot of times we'll be able to see this as somebody breathes in, you're expanding your chest, that area sucks in, and when you breathe out, when everything kind of relaxes, it goes opposite. Oh man, that was cool. Cool mechanism. Let me smash somebody's head with other skulls. Typically, fractures don't just explode like that when it comes to the skull. They just basically crack open. Obviously, there are exceptions to the rule when a lot of force is occurring.
The force is strong in this way.
Car accidents or when people fall from great heights and their brains smatter out, then skulls come into pieces. And your everyday injuries, typically it's just a one-line type fracture. Oh, nice. Wait a minute. I thought Superman could defend himself against anything. Obviously not. You're going to burn the skin. It could be as simple as a first-degree burn, which is like a sunburn, versus a second-degree burn, which just causes those blisters. Could be quite painful. And then could be even a deep second-degree burn that may or may not heal well. And then there's third-degree burn, which you singe it so bad that the pain actually gets a little bit better because you've like singed off all your nerve fibers. Oh. Oh, sweet, the opposite way. Sub-zero, nice. We do see a lot of cold, hypothermic type injuries in the emergency department. Maybe not as much in Southern California, but when I worked up in the Northeast of the United States, we saw cold injuries, especially people left out in the cold. Frostbite, where basically their usually fingers and toes turn black, and usually they're too late, so there's not much to do except amputation thereafter once it's been demarcated. Oh. The kiss of death. Fire injuries. If somebody actually has any concern for airway compromise, we will actually intubate them right away. Meaning, hey, we see evidence, singed nose hairs, soot in the back of the throat, burns to the face. You might be fine, but if we wait to see if you're fine and you turn disastrous, it might be too late. Oh, could you injure somebody's neck so bad like that and cause them to not live? Yes.
Yes.
It has to be a high cervical fracture, dislocation, spinal cord injury, because it has to do with your breathing apparatus, nerve impulses, as well as your autonomic nervous system functions, which kind of overlap into the same thing. Oh! Two different injuries, grabbing a hold of the neck and almost like a choking aspect. You're decreasing blood flow in and out of the brain. And then if you're strong enough, are you collapsing the trachea and not allowing somebody to breathe as well? And then add insult to injury, let me smash you on the ground and crush your lower back. Obviously, crushing your lower back is only going to inhibit the lower extremity. Your lumbar area sends all your nerves down from basically your hips all the way down to your legs. Whoa. Oh. Puncture wounds to the thorax. You don't know if it's going to the lung or the heart. You hit midline structures on either side, say a nipple line. You're going right through the ribs into lung tissue. You're going to puncture the lung and cause some bleeding, probably. So you get something called a hemopneumothorax, getting blood around the tissue as well as air, which then will push down on the lung itself, not allowing it to expand to get oxygen in. Oh, man. Massive compressive forces to your ears. It's going to cause a lot of pain to your eardrum and possibly a ruptured TM or tympanic membrane, aka your eardrum. And it's going to be very painful and maybe a little bloody because you do have a blood supply to this very thin piece of tissue. And if it ruptures open, it could bleed. We'll see this incidence where people have really bad ear infections and basically it ruptures open and you get the pus comes out, but then you also have a little bit of blood. Oh. I was not ready for that. It is an old school video game. Those things were so heavy. I mean, they're still out there causing crush injury. I just think it's funny because it's a Mortal Kombat game. They do a pretty good job in this scene where the body's still kind of like twitching, moving. Could that be because the character's still alive? Maybe. Versus action potential, so there's still movements. Even sometimes when people pass away, they could still move around because there's still the energy flowing that hasn't stopped yet. Oh, nice. Oh, man. The face can take a lot of damage without actually killing somebody. A lot of bone in the way, so the bones of the face can break pretty easily, but what's protecting the brain is a lot thicker. You have your frontal bone that's really thick up here. Your frontal sinuses, actually there's a gap in there that can actually break, but typically it's the outer part that breaks first. And then obviously your cheeks can break pretty easily as well because there's air pockets behind that. Oh, nice. The biggest things that we worry about with electrical injuries is cardiac arrhythmias. Typically will cause people to go pulseless. How do we get them back? We need to shock people out of those. That's the best way you can help somebody. VFib or VTAC. Those are the two rhythms that you can actually shock. You can't shock any other rhythm. Won't work. Where's everybody? If you are a gamer and are playing this and you want to stay sharp and focused, that's where Level Up comes into play. Visit lifehappens.com and we're also on Amazon. Check it out. Oh, wobbling around. Oh, 2 stab wounds. Probably getting into the heart a little bit. Maybe on that right side you're gonna miss, but sometimes people have really big hearts. It's actually not good when you anatomically have a big heart. Figuratively, yes, but anatomically, no. Typically means that your heart's working too hard. You want just a normal size heart. Massive blow to the abdomen. How does that get you? Does it explode your organs? Does it rupture your liver? Does it rupture your spleen? Does it crack open your abdominal aorta and cause you to bleed out? Does it rupture your kidneys? All the above could potentially happen. We see these with massive traumas to the abdomen, usually relating to car accidents. Whoa. Oh, geez. Big laceration to either the neck or the chest. We don't see the effects of it. We just see a little splash of blood, which is fine. But anytime somebody has lacerations around the neck, especially between your jaw and the clavicle is zone 2, we really worry. And typically if it's, through the skin, you're gonna be taken to the operating room to have exploratory surgery to make sure nothing is damaged underneath. Oh. There are people that can throw cards that intensely that can actually cause lacerations. People can use anything to hurt each other. Please don't. Here, obviously, these wounds aren't that deep and should not cause life-threatening injury. Obviously, it's a lot of soft tissue, maybe a fracture of a bone, but they're not going deep in there. Oh! Oh! Catwoman.
Meow.
Cats in general wreak havoc on our systems relating to possible infections. There's always bacteria related to their nails and their teeth. They can puncture into the tissue and that bacteria stay. When you get a big cut, you're always worried about infection, but it's big and open and it bleeds a lot and you can clean it really well. So the likelihood is low versus when somebody gets a puncture wound from an animal, it just seals in. Oh. Big sword right to the middle abdomen. What are we hitting? High up there, we call that the epigastric area. So your stomach, your pancreas, those are big structures midline. Your intestines, your omentum, and then obviously you always worry about your inferior vena cava, the big blood vessel in the abdomen, and then your abdominal aorta, which is the big artery